glenohumeral joint, which is a ball and socket joint. It allows movement in all three planes of motion. It allows flexion and extension, abduction, and adduction.
So we ask our client to do an abduction to identify which shoulder had a problem. So we started by doing the left shoulder to do an abduction on the left shoulder. See, as he reached 15 degrees, he starts feeling the pain. So this proved that left is an affected shoulder compared to the right. So we were able to identify which muscles that were affected on the left shoulder. It is the supraspinatus and the deltoid muscles, which hold the humeral head in the glenoid fossa. So if our client is affected on the supraspinatus starts the abduction from 0 to 15.
Whenever our opponent is doing overhead arm rotation, it becomes difficult, which is part of the limitation.
So the sternoclavicular joint allows for clavicle contraction and elevation.
The angular motions include elevation, depression, protraction, and also retraction.
So the subject's weak or inactive muscles would be the subclavicus, which acts as a stabilizer, and the sternocleidoid mastoid, which allows for movements such as protraction and elevation. So with the mechanical analogy, it would be a saddle joint, but also acts as a ball and a socket joint.
The examples include the metacarpals, which are found in the thumbs.
Okay, I'll be discussing the primary angular motions that occurs in the AC joint. The AC joint allow rotational movement between the end of the scapula as well as the lateral end of the scapula. Primary angular motions are the upward rotation of the scapula and downward rotation of the scapula in the AC joint. The mechanical analogy of the AC joint is that the AC joint acts like the plane type synovial joint.
Just for clarity, AC joint is located at the lateral end of the clavicle where it meets the acromion of the scapula. Thank you.
In terms of like the scapular-humeral rhythm test, if the subject is injured on his left or right scapula or his left or right shoulder, we're going to see that the scapular thoracic joint, whenever the arm abducts, the scapular thoracic joint will not be able to allow sliding of the scapula on the rib cage. And then we have abduction, we have elevation and depression, whereas the scapula will not rotate upwards or downwards. And then we have protraction and retraction, whereas if there is pain in the left shoulder, the scapular thoracic joint will allow any functional articulation of the scapula on the rib cage.
Scapular thoracic joint is not a true synovial joint, so it will allow gliding and sliding